Hello, everybody. My name is Dr. Abbas Khushnood, and I'm a consultant pediatric cardiologist and transplant physician at the Freeman Hospital in Newcastle. I'm also the national clinical lead for the National Congenital Heart Disease Audit within NICOR. And I'm pleased to be here to discuss the National Audit Report today. As you know, CHD in children and adults forms part of the 6 domains that we report in our National Cardiac Audit Program. And just before getting on with the report, I thought it's important to highlight a few facts for congenital heart disease. As you probably most of you know, that it's one of the most common defects in the world. About 13 babies per day are born in the UK with some sort of congenital heart disease, making them about 1 to 2% of the UK population. And that means that about 6 to 8 in every 1,000 live births have some form of congenital heart disease. And more importantly, 25% are critical conditions which require surgery. We've got an extremely good pickup rate antenatally. So on a 20-week scan, more than 50% of CHD patients would be spotted during pregnancy. And in terms of surgical outcomes, we have one of the best outcomes in the world, with some procedures nearly 100% in terms of survival rates. And not surprisingly, more than 80% of patients will then move on to adulthood. And in the UK, currently, we have over 250,000 adult patients with some sort of congenital heart disease. And this is a growing population, which we need to be mindful of. And that brings a huge cost burden to the NHS. And it's important to reflect that congenital heart disease is a complex mix of cases, and hence the audit program makes it more important to ensure that we have a good pickup and outcome rate from these procedures. So the National Congenital Heart Disease Program forms part of the NICOR NCAP reporting, and this year the annual report was published in October 2021. The annual report also consists of patient care and public report to highlight the aspects for the general population. And within the congenital heart disease audit, we reflected on various aspects of treatments that were provided for both pediatric and adult patients. The cartoon on the right gives you an idea of a glance or glimpse of all the variables that were captured in the reporting period. Given that we've only got 10 minutes to discuss the report, which is long, I'm just going to focus on the key messages and just highlight a few important aspects for all the key messages. So in terms of procedural activity, which is the most important aspect of the auditing program, it captures surgery, interventional procedures, diagnostics, and electrophysiology. The mortality for each procedure is calibrated using risk modeling, and that gives you outcomes for survival for both children and adults. Antenatal diagnosis forms an important element of our reporting period, and we highlight 4 important aspects of the reporting: hypoplastic left heart syndrome, transposition of the great arteries, complete atrioventricular septal defect, and tetralogy of Fallot. The post-procedure complications form part of the reporting period, and we will be highlighting those. As I mentioned, we are constantly in the process of improving things, and this year we are reporting fluoroscopy data as part of a case study, which I'm going to highlight in my talk in a bit. And finally, data quality indicator, which is an important aspect of our reporting period. So moving on swiftly to the various key messages. Procedural activity. This year, we reported just over 2,000 congenital heart disease procedures, both in children and adults. And this graph over here gives you an idea of the trend that has been going on for the last 10 years. As you can see, it has been very stable. However, there has been a slow decline or a short decline of some cases, especially in the pediatric population, with good increase in the adult and the EP interventional procedures. About 4,000 patients are from the adult category, while the remaining are from the children population. Next is surgical outcomes. So surgical outcomes has been always excellent and comparable to international standards over many years now. This year, we've reported a 30-day survival rate of 98% with a crude or unadjusted mortality of 2%. Similarly, in the adults, we've had a very high actual to predicted survival ratio of 1, and that is for all the 3,000 procedures. So if you were to just break this a bit more into a graphical presentation, here is the 30-day survival for the 12 centers in the UK for pediatric surgical procedures. And you can see that most centers are in the white bar area of the columns, which means they are within the predicted range, with a couple of centers at a higher than predicted value as well. And this table just gives you an idea of the 11,000 or so procedures that were taken, with more than 97% predicted survival, giving a ratio of 1, which is as predicted or better. Similar graph in terms of adult congenital heart disease, most centers lying in the white bar area, suggestive of survival as predicted, a couple of centers at the top and bottom end as well. And again, for over 3,000 procedures, the actual survival was 98.5%, giving a predicted ratio of 1, and which is excellent for adult congenital heart disease as well. Next is antenatal diagnosis, and the table on the left clearly shows that if you see the last 3 reporting periods, we've had a stable antenatal pickup rate of over 50% for patients diagnosed with congenital heart disease antenatally and had a procedure in the first year of life. The light blue graph gives you the average curve, and then you can clearly see that hypoplastic left heart syndrome, which is univentricular anatomy, is quite high on the bar with about 90% pickup rate, with the other 3 lesions being between 70 and 80%. And again, this is reflective that we've got really good antenatal pickup rate, but more needs to be done in terms of general training for sonographers at the 20-week scan to be able to pick up these defects much better. Post-procedure complications that have been reported are just listed in the slide here. And one of the important complications is neurological outcomes, which we have excluded in this report, as we are working to try and better define this variable to allow consistency in terms of how it is picked up by all centers nationally to reflect the true picture of these complications. Fluoroscopy. So we were quite excited to add this as part of our case study, and the aim is to try and set reference standards by analyzing radiation doses and screening times across all the pediatric centers nationally. And the aim is to get an intercenter variability of the usage of dosages in the similar procedures, so that we can hopefully aim to standardize this and provide some referencing points to minimize radiation exposure for these complex patients. This study was piloted for the first time, and the aim is to try and improve it to be able to provide more data and outcome analysis to set these standards. And finally, data quality indicator. I think this is an extremely important aspect of reporting, and we're very proud to say that overall GQI scores remain good to excellent. As you can see in this table at the back, which is sort of just a reflection of how the data is collected, more than 8 centers have performed over 98% or more, with the majority of the centers between 95 and 98%. And this is a huge praise for all our database managers in the efforts of trying and submitting data on time and making sure that it's a high quality data with very little room for error as we report them. So thank you to everyone for doing an excellent job there. And that finally brings me on to this slide of future reporting. While we're doing excellent work within the NCHDA in terms of reporting multiple variables in complex patients with different heart conditions, it's important to highlight future ways of improving things. And one of the things is existing variables like complications, which need looking into and ensuring that the definitions are much more robust and in line with what is required by database managers to input the data to get accurate information moving forward. Long-term outcomes have been talked about for a long time now, and I think it's important for us to try and move away from just short-term or 30-day mortality and survival to looking at how patients do in the long term. And that forms a very important aspect of our reporting in the future. Making sure that we are constantly updating our risk modeling platforms, and recalibration forms an important aspect of that. One of the things we are also very keen and excited is to try and collaborate with other international registries. And we are very keen to see if we can partner with Europe on North American registries to try and improve our outcomes. And finally, research development forms an important aspect of our of the audit program. And we're doing already so much in research that we will continue to improve on that and make further strides into it. On-write reporting tools will be talked about in our webinar today, and I can only say that it's an excellent real-time tool that has been implemented by NICOR, and we are very excited to use in all the domains in the future. And I would like to thank everyone within the team, without whose efforts this program would not have been successful as it is. And it's joining the dots together and making sure that everyone works together to give an excellent outcome. And thank you very much for your time. And I'm happy to take any questions towards the end.